elimination program. So tell us, where is Nigeria on the timeline for achieving this target, which is in the final stage?
All right, thank you so much. So currently we're implementing the National Malaria Strategic Plan 2021 to 2025. And, you know, the last indicator survey conducted was in 2021. And we are planning to conduct the 2025 indicator survey, which will tell us the status. And like had been mentioned, we have been deploying high impact intervention, which is in line with the global best practices, in line with the WHO global technical strategy, of which oftentimes we pilot in country before we deploy. So we have been deploying interventions such as the preventive interventions. We have the insecticide treated nets, of which since 2010 up until now, we have distributed over 300 million nets to the populace.
Where the rural areas or the urban communities?
Yeah, in both rural and urban, but majorly of recent we are now concentrating more on the rural areas because, you know, oftentimes, like it's described, malaria is a disease of poverty, and often, even from our indicator survey, what we have seen is the fact that the incidence of malaria, it's more amongst the low-income earners, and so we focus interventions majorly on the community level. And even in countries where elimination has happened, you will realize that you have to focus intervention and work closely with communities for them to own this intervention and also utilize them optimally.
Okay.
Yes, and then we have also other preventive interventions. You know, we have a lot of preventive intervention because we don't even want the populace to come down with this disease, because it's easier when you're very nipped it rather than it happening and then you have to treat. So we have, apart from the insecticide treated nets, the seasonal malaria chemo prevention, which is another high impact intervention that has been recommended since 2012, and we have made progressive progress in deploying this intervention from 2013, when we just piloted it and we reached about 200,000 children. Currently, as at last year, we reached over 29 million children with this intervention across 21 states. So the reason why it's seasonal is the fact that it is deployed in areas of highly seasonal transmission of malaria in the country, and majorly it's in the northern part of the country where we have seasonality. Rainfall patterns often commences from June, you know, reach its peak in June, and then also ceases around October. So in the north, we're doing the seasonal malaria chemo prevention, and in the southern part of the country, we are piloting what we call the perennial malaria chemo prevention, which is almost similar to the seasonal malaria chemo prevention. Also, as part of prevention, recently the malaria vaccine has been already talked about, not to overflog it. We have commenced deployment in Kebbi and Bayelsa states, and the plan is a phased approach of deployment. We are planning to scale up to additional states, but, you know, like had been mentioned, the global availability and access to this vaccine is still not at optimum, and reason why the country was allotted 1 million doses, which we have taken stock of and have been deployed to those 2 states. We were pragmatic in choosing those 2 states because, for example, Kebbi State has the highest burden of malaria in the country. It has been consistent since 2010, when we had the first malaria indicator survey. Kebbi had 63% prevalence. By 2015, it had declined to 52, and more recently, there's a minimal decline as well to 49% in Kebbi State. So when we say the prevalence in the country is 22%, it varies Lagos State, for example, is at the verge of elimination of malaria in the country. So a number of states are also below 6%. A good example is Kwara State, for example, where we were able to deploy intervention, new interventions, like from 2021 we commenced seasonal malaria chemo prevention in Kwara State, and also the new net project happened in Kwara State, alongside other key interventions such as prompt diagnosis and treatment and then surveillance.
Okay.
We were able to see a marked decline in Kwara State from 25% to 6% recently. So we are making progress, and we know that by the time we are able to conduct a malaria indicator survey in 2025,
that is by the end of this year.
by the end of this year, we would be able to tell. And more recently, let me quickly add, the coordinating minister of health, we haven't seen such, political commitment in a long while at ensuring, changing the narrative of malaria burden in the country, because globally, we keep reporting Avon carrying the highest burden. He had organized a rethinking malaria roundtable discussion with global leaders, all the top names, a lot of resource persons that had helped other countries to bring down the burden were convened and deliberated, and he had set up the Amen group, where we have top malaria resource persons across the globe coming to advise Nigeria. That's the Advisory on Malaria Elimination in Nigeria. That's the Amen.
Okay.
That has been done, and more so, he has also commissioned the need for us to have a pragmatic, costed plan to ensure we have the exact and the resources and the itemized intervention that we require to push the country to elimination. That has also been done. So that meeting came out with strong recommendations, that's pragmatic shifts and actions that would lead Nigeria to elimination. Okay. A number of them also is the need for the country to have manufacturing in country that is quality assured medicines are manufactured and WHO pre-qualified. And just recently, one of those companies in Nigeria has also received WHO pre-qualification to manufacture sulfadoxine pyrimethamine for prevention of malaria amongst pregnant women. So those are just a few of some of the programs.
All right, thank you, Dr. Shekarau.